a lot of people are just learning about this morning. Hyperemesis gravidarum. Some call it an extreme form of morning sickness, but it's more than morning sickness.
Well, it is an extreme form of morning sickness that affects up to 2% of babies, but it's so severe that a lot of times instead of gaining weight, mothers lose weight. And for someone, frankly, who's as thin as the Duchess, it could mean that she not only loses weight, but then becomes severely dehydrated. Her potassium and sodium levels start to shift, and then you have to worry about the fetus and her overall health. So the treatment is hospitalization, IV fluids, giving her drugs, and to decrease the nausea and vomiting, and frankly, bed rest.
You know, I've met a lot of women who have had this and experienced it. It's just awful. What causes it? Do we know?
Well, it's usually huge hormone shifts that the placenta starts to put out a big shift, something being called HCG. And that's where the speculation of twins come in. If you have two fetuses that are putting out sort of double the hormones, could it be that? Some people are speculating girl. I think the real downside here is that, as we know, most women who are pregnant want to get through that first trimester before they make an announcement, but their hand was forced by this, and the palace had to make an announcement.
When you talk about a woman, especially one as thin as Kate is, losing weight during a pregnancy, even in this early stage, is there any risk to the fetus from this?
Yes and no. I mean, fetuses are really hardy, but what we know is that fetal development requires good nutrition, especially in the first trimester. So we don't want to see a woman ever lose weight. We want to see her at least hold it. She's under the spotlight. The pressure on her will be to gain not too much weight in pregnancy. Her doctors right now, though, are urging her to put on some weight, gain a normal 20 to 30 pounds, and get through this. And obviously, we just want to see her get through this first trimester and then on her way.
Very quickly. Often this clears up in 12, 14 weeks, but some women experience it all through pregnancy.
It usually starts about 6, 7 weeks into a pregnancy, can go into 20 weeks, which is about 5 months. I would suspect that if she's this ill this early, this is not going to be a 48-hour bout.
Dr. Nancy Snyderman, thanks for the information.